Welcome to this episode of Jing TV where we're doing Challenge the Camera. So one of the things that comes up a lot in advanced clinical massage is about assessment.
Yeah.
And in particularly how to go through the ranges of motion of different joints and how to take your client through it. So I think it's important to show the different ranges of movement of the shoulder because that's something that gets a bit confusing. However, the confines of our little studio are not allowing me to stand up. So I'm going to try to do this all sitting down and being very professional and very, very clear. So the episode is really about the range of movement, how to test the ranges of movement of the shoulder.
Yes. Okay. Go. So what are the ranges of movement of the shoulder?
Well, first we have to talk about what the shoulder is. So if you give me your shoulder, up into the camera. All right. So the shoulder is complicated. It actually has two joints. One is called the
glenohumeral joint.
So good. And the other one called the
scapulothoracic joint.
Very good. Okay. So the glenohumeral joint is what we know to be kind of the ball and socket joint, the greatest range of movement of any joint in the body. And it has quite a few movements, but we're going to keep them quite limited in this camera circle. So the first movement would be abduction. Very good.
You're doing it to me because I didn't know what it was.
Yeah. And then adduction. Very good.
It's coming back to the body.
Coming across.
Yeah.
And then flexion. Very good, Rachel. And extension. Very good. And okay, so we can't, is the camera in there? She's getting her elbow in there. And then this is external rotation. And then this is internal or medial rotation. Okay, so those are the big ones. I know, because I'm aware the last one is circumduction. I'm about to get hit in the face. All right, the next one is circumduction, which is a cone-like action of the arm. Okay, of the humerus. So when you're getting somebody to do that, you're going to try to get them to do it actively. And in our case too, sometimes we try to get them to do it passively, so you move it, or against resistance, which we talk about with orthopedic assessment. So those are all the ranges of movement of the glenohumeral joint.
When you're doing assessment, you generally do it standing up, and you could get the person to do both those actions at the same time.
Could you do
without
that?
the elbows? But so that would be, you get them to do that for abduction. I realise I'm probably going out of shot, and then bringing the arms forward for flexion. Bringing the arms back for extension, internal rotation, bringing the arms across the body.
Good.
External rotation, bringing the arms
And what if you put the arms across? So that's adduction, but it's also horizontal adduction.
Yeah.
Okay, great. I think we're getting thumbs up with the camera.
Yeah.
The other action, which I kind of want you to move, but is about the scapulothoracic.
Yes.
So the scapula sliding over the thoracic rib cage. So the first movement is elevation. And then depression, and then
I'm being depressed.
I know. Protraction.
Protraction.
So protraction, which is abduction.
Yeah. So the shoulder blade comes across.
Or retraction or adduction of the scapula. So they're sort of coming together. And same. You kind of want them to come forward and back. And you want to get them to do both sides at once. And I would not sit here and do it when I'm doing an assessment. I would stand in front of my client. Yeah. I'd stand behind my client, and I'd also stand at the side.
And noticing the movement of the scapulas as well, particularly on abduction.
Yeah. Great.
So get that into your treatment protocols, and
then the last bit of it,
assess before and after.
Before and after. Yeah. And if Rachel, for instance, couldn't do abduction, the next point of the puzzle is realizing why she can't do that. So is it because the muscles that do abduction, so for instance middle deltoid and supraspinatus, if there's something going on with that, or the ones that are doing the opposite action, the adductors, aren't relaxing and letting go and letting that space occur, that action. So we'll take care of that in a different episode, but I just wanted to go through the ranges of motion of the shoulder in the frame. All right, hopefully that was helpful, and we'll see you next time.